Whenever we have a patient of ocular trauma at our hand, one should know how to basically deal or how to basically start off managing such patients. The management starts off right away in the emergency department when you're dealing with these patients. If it's such a serious case of ocular trauma, that is basically a multiple trauma has occurred, for example, in road traffic accidents, usually patients encounter ocular trauma along with the other traumatologies. So it's basically depending upon the fact that what is the most serious trauma that has occurred to the person, and you'll start dealing with each one of the injuries one by one. If it's just a case of ocular trauma, history taking is again very important over here. So first of all, starting off from the patient particulars, you're going to start off with the age and the gender, the occupation of the person, and then you're going to start off with the presenting complaints and the history of the presenting trauma. The patient would usually give you a history of a foreign body that has basically damaged the cornea, or even it can be a penetrating or a perforating kind of a wound. So whatever the causative agent was, that is again very important to identify the causative agent at this point, just for the final assessment and the final management of the patient. Again, I would like to emphasize on this fact that the assessment would start off with the history taking, and the management is basically depending upon the complete and the detailed assessment of the patient. So you'll be basically examining the main systems of the body, that is the airway, breathing, circulation, as you start off with any trauma, and then you're going to stabilize the patient first of all, and then you're going to move on to the assessment of the patient once the patient is stabilized enough that you can start off with the history taking. The patient is not conscious, or if it is a case of a serious trauma, you can start off with the history taking from the relatives or the friends or even the people who have brought him to the hospital. So these are the initial steps that you're going to take. Once you have the patient with you, you're going to start off with the detailed history of the patient. Once the particulars and the presenting complaints are documented in detail, you're going to move on to the past medical history. The family history is again very important over here, because that is going to point out toward a lot of the systemic diseases that can basically complicate the current traumatic situation. So it's again very important to know the family history in detail, the socioeconomic history, the past medical and surgical history is going to make the management more easier for you as a physician, or if you're even referring the patient to an ophthalmologist, a complete document must be attached along with the referral case. So these are the initial steps for the eye trauma assessment case once you have this patient with you in the emergency departments. In this particular section, we're going to focus on the history first of all, the examinations that would be included in the ocular trauma cases that would be discussed over here in detail. Obviously, it is any traumatic case, you have to basically inspect the case first of all in detail. You're going to move on to the slit lamp examination, and then you're going to further move on to the visual acuity testing, the visual field testing, just to know whether the central trauma has occurred to the person, whether the nerves are damaged, whether there is a traumatic ptosis that can be observed at this level or not. And then you're going to move on and decide what kind of a repair surgery has to be done in this particular case of trauma that we have at our hand. So it's again very important what kind of a repair can be done in a particular case, and what are the do's and don'ts that are related to this kind of a repair that we're talking about. So the lacerations are one of the jagged injuries that can occur to the ocular structures, or that can occur to the orbital structures in case of ocular trauma. And that one should know that what are these lacerative injuries that can occur to the ocular structures or the orbital structures, and that we'll be discussing over here in this particular section over here. So first of all, the outline of this particular eye traumatic assessment surgeries that we're talking about. The assessment of the trauma is very important, that we've already talked about. It's the type of injuries that one should know. The complete detailed history would give you the complete outline of a particular case that we're talking about. It's usually the type of injuries that are occurring to a particular person. It can range from the peri-ocular injuries, that is basically the trauma that has occurred to the peri-orbital structures. Now, this peri-orbital structures, it can include the bony structures of the orbit as well. It can be the damage to the medial wall, to the lateral wall, to the roof, and to the floor of the orbit, or the basically orbit is a conical shaped or a pyramidal shaped sac, or the bony structure which is basically containing the eyeball of the person. So one should know the complete anatomy of these bony orbital walls and what are the structures that are lying in close relation to these bony orbital walls. For example, if we talk about the superior and the inferior orbital fissures that are basically located at the basically the floor or the roof of the orbit, we should know the structures passing through this superior and the inferior orbital fissure, because any damage or any fracture that can occur to these fissures, or it basically can damage the structures that are passing through it. For example, the oculomotor nerve is one of the nerves that can be damaged over here. The optic nerve can be damaged due to fractures or trauma to any of these structures. Now, if we talk about the structures that are basically lying in close relation to the medial wall of the orbit, it's basically the nasolacrimal duct and the nasolacrimal sac that is located in the medial wall of the orbit, and that can be damaged whenever trauma occurs to the medial wall of the orbit. So these relations should be well versed with. An eye surgeon should be well versed with all of these relations, just to know that whatever trauma has occurred to the eye or to the walls of the orbit, it can damage what structures. This is again very important to correlate all of this traumatology with the structures that are lying close vicinity to the orbit. Then we have the anterior segment, and then we have the posterior segment. So if we talk about the orbit in itself, we should know that what are the structures that are lying in the anterior segment. It's basically the lens, it's the iris that can be damaged. Then we have the external structures. For example, the lids can be damaged. It can be the upper or the lower lid. The cornea can be damaged, as if the corneal, for instance, corneal aberrations is one of the very common example whenever a person is exposed to any foreign body damaging to the external of the eye. It's usually the corneal aberrations, which are not quite visible on a naked eye examination, but still they're very painful and they're causing a lot of irritation and a lot of redness or allergic reactions towards the eye. So then we have the posterior segment. Whenever we talk about the posterior segment, there are a lot of structures that are valid for the posterior segment of the eyeball. For example, it's the retina, it's the choroidal plexus. So finally, if the retina and the choroidal plexus and all of these structures that are in relation to the retina, whenever they can be damaged, it's basically the optic disc, the macular vision, as in itself, the macula can be damaged, which is basically responsible for the central vision of the person. So all of these damage, which is basically occurring to the structures in the posterior segment of the eye, can directly affect the visual acuity of the person, and sometimes it's an irreversible damage that has occurred to the person. So it can be even a chemical injury. Chemical injury is basically relating to the vitriolage or the acid throwing or any other chemical that can be basically damaging for the person and for the structures in the eyeball or in the orbit. So the mainstay of the treatment over here is to wash the eye thoroughly with clean, plain, saline water, and then basically you're going to apply a lot of antibiotics and steroidal topical treatments to the person. So this is basically the treatment that is given in case of vitriolage, which is also known as a chemical injury in the patient. Now, there are a lot of epidemiological facts that are related to this kind of an ocular injury. 40% of the monocular blindness is related to trauma. The leading cause of monocular blindness is again trauma, because usually any systemic diseases, if they're found any, they're going to affect both of the eyes equally or almost equally. For example, if it's a diabetic retinopathy, it's going to affect the eyes almost equally. And then if there is any other sort of diseases, for example, if there are any autoimmune diseases or any syndromes, then even it is going to affect bilaterally. And it's usually the cause of the monocular blindness in a lot of cases. So 70 to 80% of the injured are usually the males. Age range is 0 to 100 years, but most are young, and the average age is almost 30 years in these individuals, because this is the age group that is more prone to even the road traffic accidents, even the trauma that can be the occupational kind of a trauma. So this age group is more prone to the this kind of ocular trauma that we're talking about. The incidence of penetrating eye injuries is almost 3.6 over 100,000 injuries that basically occurs to the person or to the eye. So it's quite a high rate. The incidence of eye injuries requiring hospitalization is almost 5.2 per 100,000, and then we have the sources of injuries. So we can classify the injuries that are occurring to the eyes into blunt injuries. They can be the sharp, penetrating, or perforating injuries. Now, whenever we talk about the penetrating or perforating injuries, it can be the clean incised wounds on one hand, and on the other hand, if it's a blunt injury and if it's kind of a very massive injury, it can result in a lacerative kind of an injury that can occur to an eye. Whenever we say it's a laceration, it's a jagged injury that is occurring to a structure, and its margins are not clean cut. So then we have the motor vehicle injuries. Road traffic accidents almost comprises of almost 9% of the injuries that we talk about, and that is happening to the orbit. The blunt objects, for example, rocks, fists, branches, champagne corks, it's almost comprising 30 to 40% of the injuries or ocular trauma that is occurring to the eye. Then we have play and sports on one hand. It can be golf, squash balls, shoulder or elbow injury. We have bats, rackets, and horse injuries. So it's almost comprising of almost 1/3 of the injuries that are occurring to the eye. The falls are comprising 4%, the sharp objects almost 18%, the globe environment in 22% of the cases. So it's usually the surface structures, for example, the eyelids and the structures that are surrounding the orbit that we usually encounter. It's only 22% of the cases that the globes are also involved along with it. So one should know, or one should be well versed with all of these statistics when you're dealing with an eye trauma case or a case of a traumatic ocular trauma or a massive ocular trauma that has occurred. The assessment, as we've already emphasized on the fact to rule out any life-threatening injuries, any other life-threatening injuries that are accompanying this ocular trauma. It can be a road traffic accident with multiple injuries. It can be a mass accident or a mass disaster whenever we're talking about, for example, bombing or earthquakes. In these cases, the ocular injuries occur along with other life-threatening diseases. So it's very important that you treat these life-threatening diseases. First of all, you stabilize this patient, and then you start treating the other ocular injuries or the other injuries at your hand. To rule out the globe-threatening injuries. First of all, you rule out the life-threatening injuries, you stabilize the patient, you save the life of the patient, and then you move on to the analyzation of the globe-threatening injury in which the vision can be involved, or total blindness can be caused due to these globe-involving injury. Examine both the eyes, and imagery is again very important. Take pictures of the person to analyze what kind of an injury has occurred to this particular person, what should be the management in this particular case of the patient. The plan of treatment is according to the imagery, according to the condition of the patient. What are the systemic or the other life-threatening injuries or the traumas that the person has gone through? You're going to document that all, and obviously the treatment plan is going to be based upon all of these investigations that have been carried out in this particular case. The history taking is very important. It's basically going to start off from the patient particulars. That is basically going to relate towards the age, the gender, the occupation, the presenting complaints, and the history of the presenting trauma. So the history of the presenting trauma is going to give you highlights towards the mechanism of the trauma that has occurred, whether it is a blunt trauma, or you're dealing with a sharp trauma, or you're dealing with a mixed kind of a trauma, which is basically blunt and sharp. So knowing this mechanism of trauma is very important. Then the forces involved, or the objects that basically cause that particular trauma, to identify those objects is again very important, because the treatment plan is going to be based on that. Whenever we are dealing with a blunt kind of trauma, the injuries or the damage that has occurred apparently is much less than the kind of a trauma or the kind of the damage that has occurred on the inside. On the central nervous system, the nerves can be damaged. It can be some sort of coup and contact injuries. So all of this nerve damage has to be assessed over here. Even the black eye, which is very famous after a blunt trauma, which is basically a punched eye syndrome. In cases of blunt trauma, it's basically due to the oozing of the blood in the extraorbital structures. So it's basically these extraocular structures that are oozed, that where the blood is oozed out or the blood is accumulated, and it gives a very horrific picture over here. So treating these, it's basically a self-limiting disease, and the previous injuries have to be noted down. So getting the past medical and the past surgical history and noting it down is again very important, because the systemic diseases would be highlighted over here. The past ocular history is again very important over here. So if the person has been suffering from some sort of diabetic retinopathy, his retina is already damaged, and any suffering or any further trauma can be quite debilitating for the person in itself. The past medical history is very important for the person, and then we discuss, or then we move on to the complete examination, detailed examination of the person with and without a slit lamp. So over here, a patient review is very important. Are there life-threatening injuries which need to be treated first? And the brain injury has to be sorted in this level as well. The facial examination is very important. You have to examine whether there is any sort of facial nerve injury. Trigeminal nerve is supplying a lot of musculature. Even a lot of the muscles of mastication are supplied after that, and a lot of muscles are supplied by the facial nerve, which are basically including the orbicularis oris, and all of the muscles that are basically a part of the group of muscles which are surrounding the eye. The laceration, bruising, numbness, and weakness is noted down whenever you are completely examining or completely having a facial examination, just to have a review whether any sort of nerve damage has occurred in this particular case or not. Now moving on to the ocular examination. The visual acuity is first of all checked out in this particular case, and then we move on to the lids and the lacrimal system. The orbital rim is completely examined, it's completely inspected. And then the orbital bones, we have to perform obviously the anterior posterior views of the skull, and even the lateral views of the skull, just to have a clear view if any fracture to these bony walls that are basically surrounding the orbit has occurred or not. Then we're going to move on to the ocular motility, if it is affected. So these tests are devised just to check the ocular motility. You ask the patient to look at a distant place, to look at a fixed distant point, and then you ask him with your finger movements to move superiorly, inferiorly, medially, and laterally, just to check out the complete ocular motility in this patient. The globe is checked for any damage, and then we're going to move on to the optic nerve. Fundoscopy, ophthalmoscopy, all of these tests are devised to check or to completely ocularly examine this patient. So over here you have this case of ocular trauma. As you can see, it's basically the punched eye syndrome as we were talking about. As you can see in this picture, it's not a case of a sharp injury or an injury that has occurred due to a sharp object. It's most likely a case of or an injury that has occurred due to a blunt object. So this impact or knowing this mechanism of trauma is very important to focus on. So in this section, we just completely gave you an outline regarding the treatment or regarding the designing a treatment plan for a patient or assessing the patient with the ocular trauma. So that is the end of the section. Thank you for watching sqadia.com.